my name is Jina. I'm 27 years old and I'm a plastic surgery junkie with a jacked up jaw. My face is droopy, it's uneven. I call myself Jowling Jina because I have these gigantic jowls. I was like 18 years old getting Botox because my older friends were having Botox. And they're like, yeah, to prevent you from getting like wrinkles. I'm like, oh yeah, that's a great idea. Botox definitely triggered my obsession for plastic surgery. I had a boob job, loved it. Lipo, hated it. Nostril reduction, traumatizing. Rhinoplasty, didn't make a difference, but I wanted more. So I thought a BBL would be a great idea. It feels real, so I mean, I love it, but I don't even like the attention because guys are like really gross and like, ooh, like no. After my BBL, I'm like, what else could I do? So I started like focusing on my face. I didn't like that I had a wide jaw. I wanted more of a smaller face. I had a consult with a doctor. I told him what I wanted and he suggested the muscle reduction and jaw shaving. They make the faces more softer, feminine, and I thought it would be easier on me because I'm already a girl. I think that was the worst recovery ever. My jaw is still kind of numb. It's uneven, so my face droops and I have like these like little fat things here and just makes me look like I'm frowning all the time. I'm a mess. Now to fix what I shouldn't have done, I bought stuff on Amazon, like contraptors. I don't know what, I guess how people use waist trainers. I use a face trainer. And I'm hoping that Dr. Nassif could give me a mini facelift and give me my old jaw back because I'm way too young to have a droopy face. Do you see the difference? With, without, with, without.
Pop it.
Oh my God. Yeah.
Pop it.
Girls' night. It's nice to hang out with the girls and just like catch up. We normally do like lingerie, face masks, champagne, food. That's pretty much like sums up our lives. All right, girls, it's time for face masks. Scylla, can you pass me my mouthpiece, please? It's a little red thing.
What is this?
It's safe to say that there's nothing I won't try to fix my face, even if it looks weird. Wait.
I'm not gonna judge you. Like,
you guys don't understand my pain.
aw, babe.
I'm exercising my jaw so I can do other things with it.
Oh, really?
All right.
Okay, get me one too. Get me one too.
Okay, we all need one.
She's showing me some new things.
Hey, I'll use some
I'm
too.
not opposed to
I'll use some too.
What do you want it to look like?
Back to my old face.
Got it.
What do you think I should do? Get a facelift? Get the jaw implant?
You're 27. You can't get a facelift. Gina is literally looking for anything that she can do to try to get it back to even close to what it was before. But I don't think she should get a facelift. Well, hopefully Dr. Nassif will be able to fix it because he's the best. He did my nose.
Oh, your nose looks so amazing.
I know,
You really
I love
think
it.
you can fix it?
I mean, if anybody can do it, it's literally gonna be him.
Cheers. Cheers. Salute.
We're gonna see Gina next,
Okay.
and she's requesting a lift.
Breast lift?
Facelift.
Facelift.
And she's 27.
A facelift?
A facelift. Take a look at her.
I mean,
I don't see that much loose skin,
no.
so let's see her. Can you please send in Gina? Miss Gina, hi.
Hi.
I'm Dr. Nassif.
Nice to meet you.
Hi, Gina. Terry
Hello.
Dubrow. How are you? Nice to meet you.
Good.
Hi, Alia.
Oh, yeah.
Yeah.
Wait a minute, you look very familiar.
Yeah, you did my nose.
Oh, my
4 years
goodness.
ago?
4 years ago.
I know. Isn't that crazy?
Looks good.
Alia's nose looks pretty darn good after all these years. I think I'll have to give myself a little pat. Actually, or a little spank, something. Gotta do something. You guys live in LA?
Yes.
Since we're both out of it,
Yeah.
now especially me being out of it, what is happening now? What does everyone do?
We do a lot of houses.
House party.
Yeah, like
kind of.
houses.
It's like
So what, you'll just go there for dinner and hang out?
We'll just hang out and
Sounds
then...
like we just invited ourselves over.
Yeah.
Like.
Did you ever go like to New York, out in Woodland Hills, the dance club or
No.
any of those things?
No,
or
I
or
knew of
Chamois?
Dylan's. No.
Walla or Chamois,
No.
the disco places?
No.
Back in our days?
I never went there. I'm so happy Paul's finally married and no longer has to worry about being hip. Now all he has to think about is not breaking one.
We know you had some jaw surgery.
Yes.
Can you take us back, because it looks like you like plastic surgery.
I knew when I was like 15, I'm like, I want my boobs done. So saved up for it. Got it when I was like, I just turned 18.
All right, so any more surgeries?
My nose, my butt,
Your butt, what'd you do to your buttocks? Brazilian buttock lift?
yeah, and my jaw.
What did you go in for?
Because I thought my face was big. Now I'm like, my face is small.
When you think your face, you mean this you thought was big?
Yeah, well, over here. I thought it was really big.
Wait a minute, way over here?
Yeah, like this part was like big.
Okay.
When I got my jaw done, my doctor shaved out my muscle, took out
Where?
my buccal fat.
The muscle shaving, the masseter muscle.
Yeah, that's it.
Shaving it. Okay, that's kind of new. We give Botox in the masseter muscle to shrink it. Shaving it down sounds dangerous. I would never do it. Any complications?
It's kind of numb still. And like, there's not enough saliva in my mouth. So I'm always like swallowing and like slurring my words.
You know, when you take buccal fat out, which is cheek fat, there's a duct right here that enters from the parotid
right.
gland, and you make an incision between the second molar and that duct. If you get too close to the duct, it can block the duct with scarring, and you may not get parotid secretions. So you might have a little bit of a dry mouth from that.
I definitely do.
Because she goes like that.
Really?
And I'm always thirsty because
Yeah.
my mouth is always dry.
Yeah.
So what are your complaints right now then?
I don't like the way it looks.
Okay.
So the main thing is this fullness you have on both sides? That's what you think the bulging is, yes?
Yes. I definitely want a facelift. That's why I tried all the PDO thread lifts and like,
Yeah, the PDO threads for what?
it's like it's supposed to be a little facelift, but I want to wait like 2 weeks.
There are threads that are used to help tighten the neckline or the jaw or to elevate the eyebrow. And you slide them in with a needle, and they have these little hooks on them. The problem is they don't last.
So you think a facelift will do the same thing, but longer lasting? Is that the whole point?
Yes.
Here's the question I have for you.
Yeah.
What do you think the chances of anyone talking her out of any procedures is?
I think you guys are the best chance, if anything.
So we're here to talk you out of things.
Yeah.
Well, I mean, let's get in the exam room. I want you to take off your makeup.
Okay.
I want to really look at that jawline of yours, okay?
Do you think it looks different on this side?
Yeah. Do you see it? I mean,
No.
it looks like I have a double chin. I can't take
No,
this
it does
away
not.
from me.
What were you doing with that, Mira?
Nothing.
She
We
was,
saw
trying
you.
to, she was trying to notice the difference.
So go ahead, do what you were doing. We're gonna watch you. Go ahead.
She was looking and then she was like, I have a double chin. And I was like, no.
Yeah, now I have a double chin. See, this. This is not.
Because what you're looking at is this right here, right?
Yeah.
That's where your buccal fat was. You're focusing on something that's really not that bad or present. Jina is way too young to get a facelift. No way. There's something called elastin, and there's collagen fibers and all these great things in the skin. Especially when you're young, Asian skin has very, very, very tight, wound up elastin fibers, which don't like being pulled abnormally. Your PDO threads lasted 2 weeks. It's supposed to last a year. A facelift is supposed to last about a good 7 years, 7 times longer. What is that? So 14 weeks? So for 14 weeks, you might look tight there.
3 months.
Okay? And then what happens?
Goes back to normal?
Shoots back to normal.
Oh my God. It's because I have Asian skin.
Asian skin has a predisposition for keloid scarring, which is thick, elevated scars. Don't do it.
Jina needs to forget about her facelift. Her skin is nice and tight. What she needs to do is come back in about another 60, 70 years. By that time, she'll be Terry's age. That's when she needs a facelift. Did we at all kind of explain that to you and making you worry about getting a facelift?
Of course. I
won't
mean,
work.
I would not want those scars and then all that work
Yeah.
and it goes back like that. So I guess the facelift is out of the question. I don't want to spend all that money for it to go back to normal. I'm still gonna get my injections and thread lifts.
Nice seeing you.
Nice meeting you.
Nice meeting you
Pleasure.
too.